Welcome back to the Tomb, everyone. You already know who it is. It's Tomb Talks with the Pharaoh. And for today's episode, it's called the Brain Wrangler. And I have a very important guest with me today. And I'll have him go ahead and introduce himself, and then we'll just get into it.
Hi, I'm Dr. Robert Roney, and you're welcome, Ashanti, to call me Bob.
Well, okay, Bob. So I guess I'll start with it. Is that how did you get into therapy, and how did you know you wanted to be a therapist?
Growing up, I always knew that I was one who felt things deeply. I would get hurt easily or feel rejected or feel lonely in ways that it did not seem like other people did. And that was a difficult learning experience. And I was learning that if I was feeling that, then other people were as well. One place that I found solace for me was in the church, and our family was very active in our local congregation. So there was a place of peace and a place of comfort. And if I received that somewhere, I also thought maybe I could offer that to others. The second part of why I do what I do is I'm enormously curious about how other people see their lives and how they make sense out of their lives. And so the more I learn about others, I learn more about myself. So it's a twofer.
That's good. And so you would say that you were a very like empathic person, correct?
Yes. Yeah. I think I have some deep empathy. But even more, I'm enormously curious to learn.
And especially with human psychology, it's interesting because how one person will react to this, like two people can react differently to the same situation. And I was actually watching something, and the person on it was talking about like trauma and trauma responses. And what the person said is that trauma isn't what happens to us, it's our response to what happens to us.
Exactly. Yeah.
And with that, could you kind of explain like kind of the trauma responses and like what trauma is for, like for some people that are listening that might say like, oh, I've never had a traumatic event, but it might just look differently to people?
Well, sure. The word trauma encompasses so much. And like you were alluding to, Shandi, it can be something what others might think is mundane, and it might be something like overwhelming. Think of the school shootings, or think of what happens to people who have witnessed school shootings. That's easily said, that's trauma. But for someone else, it might be something much smaller, a car accident, where someone is, I'll just use an example of someone I know who was rear-ended and it really shook her up. And so she continues to be like traumatized when she's in the car and watching very vigilantly about who's behind her. Like you alluded to, the trauma is not the event itself, it's the impact on the person and how that impact stays with us, usually in an anxious or hypervigilant way.
Mm. And with that is that, so obviously people have heard of like PTSD, post-traumatic stress disorder, is
Sure.
that when someone experienced trauma, it doesn't necessarily lead to PTSD. It might just lead to different other, I guess, symptoms or disorders, correct?
Yeah, might not even lead to a disorder. It could be that this happened to me, and the way I'm wired, the way I live my life, it does not change how I live my life. Uh, it the PTSD diagnosis is related to how it impacts the person long term.
Mm. Okay. Okay. And it's like you said, is that there's different events that can be traumatic, but it's not always like how it's depicted in the movies where it's something very like extreme. It could be something kind of subtle. another thing that I was watching, because I watch a lot of like therapy, psychology type of videos because I love psychology. In another world, I probably would have been a therapist myself. Um,
We could still use a good one.
well, I'm pretty much a therapist for my friends, so I feel like I'll do that. I'll draw my circle around them. But what the person was saying was trauma might not be something that happens. It could also be something that doesn't happen, and that's something that I found very like insightful because especially like in terms of what's it called adverse childhood experiences, or they call it ACEs, is that sometimes people always look at what happened to you, but also you have to look at what didn't happen, like
Yeah.
neglect, childhood neglect.
Well, that's where I thought you were going, is that some of the needs during our, as children are being raised, if they're not provided, shelter, food, safety, nurturance, compassion, um, that can lead to long-term problems for a person. Would we diagnose that as a PTSD? Maybe not, but maybe something might happen for a person. And then that triggers all of that loss that they had growing up.
Mm, okay. And I guess that's because I think like sometimes like with most like layman people is that when they think of um, trauma is that is they always kind of relate it to what happened to you in your childhood. It like impacts and plays like a profound role in like who you are today and the type of personality that you've constructed. Would you say that that relatively holds true for the most part? Is that
Yeah, for the most part, I think you're spot on. You know, when we're children, or when my children were little, they're sponges. They're soaking up everything that's going on around them. And they don't have the same kind of filters that we do as adults. So those kind of events or losses or vulnerabilities are going to play out in a much deeper way as they get older.
okay? And I I find that very like just interesting because sometimes from what I've seen and then also just what I've read is that sometimes people will be reacting subconsciously to a event that they've had in their childhood and they aren't even aware of it. So um I know like in movie and media, it's like they talk a lot about like repressed memories and something just flaring up. Is that something that's actually like real? And have you seen that within your practice?
Well, I have seen, I would not call them repressed memories, but I would call it that events that have happened to someone in their childhood is not part of their awareness while they're an adult, but then there may be some event. Uh, let's take, for example, homelessness. So as a child, they may have experienced homelessness, and then as an adult, they've got a lot of coping mechanisms and they're successful. And then all of a sudden, something happens and all of a sudden they're back out on the street. And yes, all of that old stuff gets brought up. Would I call that repressed? Probably not. But I think we hear more often in popular culture things like sex abuse, things like where children are somehow mistreated and often in a sexual way, and then they don't remember it, and then all of a sudden something starts to happen, and then there are events that bring things back up. So do you want me to say more about that?
If sure.
Okay, so I'm thinking about, for example, someone who has been sexually molested or touched inappropriately as a youngster, and then as they become a teen or a young adult, and they want to start to explore their own intimacy, and then all of a sudden they start freezing or getting frightened or shutting down, or then we can say that isn't repressed, but it's certainly it's out of their awareness, and all of a sudden it comes right back to the surface.
Okay. So it's kind of like it's kind of like that app that's running in the background. And you're not you don't know about it, but it is there.
Oh, I like the metaphor. Sure.
Okay. Okay. So I guess that's one like misconception that people have about, I guess, psychology is like repressed memories, or um, yeah, they just call it repressed memories. So my question would be is that what are some other misconceptions that people have about therapy or about like therapists that you've seen?
Well, I'll start with the misconceptions about therapists, because it often happens when I'm at a social event. People think that I'm analyzing them, or they get very anxious, or they feel very exposed. And I'm not really interested in doing that at all. And then there's some kind of like awkward joke made.
Mhm.
Oh, I'm sure I'm being whatever evaluated.
At
So,
that point, it's like you have to pay me for this. This isn't for free.
you know, that has been my comeback. Uh, but when I'm in a social setting, I just want to enjoy myself, just like
Mhm.
anyone else. Um, I think one of the misconceptions about therapy, well, I think there are two main ones. One is, well, I'm going to go with three. One is it's very, very expensive. And so, quote, I can't afford it, or it's only for the wealthy.
Mhm.
And many insurance plans take care of insurance, but even for those of us who do private pay and you pay for our services, um, while it may sound expensive on the front end, compared to what people spend on vacations or eating out or whatever, we're not that expensive. The second one is they want to be fixed. There's this notion in psychotherapy that they're going to be fixed. Like somehow people have this perception that they're broken, and they're going to somehow be put back together. I'm thinking about the Humpty Dumpty, falls, and or somehow we're going to put it back together. And
Mhm.
that's not really how psychotherapy works. Um, and I think the other one is that they're scared to be really vulnerable. I think there's really a fear right now in our culture to be open and vulnerable is really a frightening thing that's going on.
Okay, thank you. And it's interesting, like what you brought up about the cost of it, and when you look at people going on vacations or going out, is that you'll you'll probably spend the same amount of money coping with your like with whatever you're going through than actually
Exactly.
addressing it.
Exactly. What I've literally said this to a couple of couples. You'll spend less in therapy resolving your issues as a couple than you will in a divorce court.
Yeah, yes, and you'll be able to keep half. And that's interesting. And then also it's like where people say like it's only for the wealthy, and I can say that also like the within the Black community for a long time it was always like, oh, like that's things that like white people do. It's like you go to therapy, it's like, oh, like you're like, it's become, I guess it was one white people do, and also it was like synonymous with wealth, but it was more so like access to that. And I think now, fortunately, more Black people are addressing their own mental health and going to therapy.
You are spot on. Uh, I think historically the African American community has been shut out of all medical care. Um, and so, what did many African Americans? They went to their local pastor, right? And he or she may have known what to say or not know what to say, but that really seems to be shifting, and I'm thrilled. I'm so relieved.
And I think I don't know if you've come across this book. but I think you might find it interesting. It's called Even the Rat Was White, and it yeah, and it talks about the historical like racism that has been in the field of psychology. And I've read like excerpts from it, and it's pretty interesting. So I think if you ever get a chance to, I can send that to you. It's a very interesting book.
Sure. Yeah.
Um, so I guess the question is that with more Black people seeking therapy, and you being a white man, is that um, how have you navigated those waters in terms of cultural competency?
Yes. Well, cultural competency is really a catchphrase right now that's very popular. Um, so I want to talk about it in terms of, for me, I will never know what it's like to be a Black man. Of
Mhm.
course, I'll never know what it's like to be a woman of any ethnicity. So I go into psychotherapy wanting to learn. Now, that doesn't mean you're going to explain Black culture to me. I mean, that's putting something on you that isn't fair. But if I'm really going to be an agent of healing, I want to learn. I want to learn your experience. I want to understand your experience. I want to walk that journey with you so that I can grow and learn and be a partner in your healing.
Mm, okay. And I feel like with a lot of times is that when people say that they want a therapist that looks like them, it's more so, what I've realized is more so just having someone who's willing to listen and be open, because not everyone that looks like you might have your same experiences, or might be from the same um, might not actually be from the same culture. Like if someone grew up in the inner city and you're a Black kid from the suburbs, it's like it's a different type of culture. And if you try to explain it to one another, they're still not going to get it. So I think it's like you said, it's the openness and willing to be an agent of healing.
Yeah. So, well, the first thing is studies are that 40% of healing in psychotherapy comes from the relationship. I have a woman that I'm working with who is African American, and she was asked in a graduate class about her therapist, or she was asked who's in therapy, and um, and she spoke up and she said, I would have thought a Black woman would have been my therapist, and now I've been working for years with this older white guy, and it's really working. Um, I have found that very enriching. I'll tell you, Ashanti, the people I have the most difficulty with are people who look like me, who come out of a similar culture that I do, and they may be far more conservative, particularly religiously.
Mhm.
And so the Bible quoters are the ones, and I'm a Christian minister, are the ones that I have the most difficulty with.
Mm. Okay. See, okay, so I want to talk to you about the Christian ministry part, but before we do that, um, could you explain to the audience what is psychotherapy? Because we've been talking about it, but I don't think we
Mhm.
actually like defined it.
Sure. Psychotherapy is a Greek word. It is healing of the soul.
Mm,
Psycho is healing in Greek. Therapy is healing. So it's the healing of the soul. So the work I do is, I think, soulful healing. What's happened in your deepest places of your life, we want to take a look at and see how that can be repaired, healed, grown, maybe becoming a more authentic person.
okay. And is that, I guess, how is that different, or is it different from, or is it cognitive behavioral therapy? Like, yeah, I'll stop
Yeah.
right.
Well, cognitive behavioral therapy has been really popular up till the last couple of years. It would look at a problem and the way you think about a problem, and the clinician would give advice on how to address that wrongful thinking.
Mm,
Studies are now showing that cognitive behavioral therapy is rather successful for about the first year, but then people regress into their old patterns and the old symptoms and old problems tend to come back again. So it's not quite as in vogue as it once was.
okay. And then so with psychotherapy, then how does that differ from um, cognitive behavioral therapy? Is it that the therapist doesn't give advice? It's just more so like searching, having the person reach their own conclusions?
Absolutely. I mean, I suck at giving advice. I mean,
Okay.
really, Ashanti, I have enough trouble living my life. So how am I going to tell you how to live yours?
Hmm.
But what I am willing to do is look at your feelings, your thoughts, your relationships, your experiences, and see what's working for you and tend to build on that. Also pay attention to what's not working for you and try to understand the underlying causes of how you got into those difficulties that you may be in.
Okay. And it's something that you said that I feel like is another misconception that people have of therapists, is that they think that a therapist, because they help other people, that they themselves have it all together.
Uh, I would never trust one of those therapists.
Okay. If they say I'm fully healed, it's like, okay, I'm gonna go to the
Yeah,
next
fire
therapist.
that person.
Okay. Because I heard something that says like a therapist needs a therapist sometimes.
Um, well, a fair amount of people I see as patients are therapists. I
Mm,
mean, I've been doing this a long time. So yes. And I would not go to a therapist who has not done their own therapy.
mm, okay.
They've got to look at that self-exploration so that I understand where are my issues and where are your issues, so that I don't put my agenda on you. Again, if we go back to the cultural competency and the cross-cultural psychotherapy, I need to be clear about what's mine and what I've been raised with and the biases I have so that I don't put them on you.
Mm, okay. Yes. And that's a good thing, because it's like, if you don't have if a therapist hasn't done the work on themselves, it's hard, like you said, it's hard for them to do a work on others. It's like if you go to,
Hard. It's impossible.
it's impossible. It's okay, it's impossible.
Don't trust them.
It's like going to a dentist that doesn't have any teeth. It's
Exactly.
it'd be very hard to look at them and be like, I'm not sure you know what you're talking about, because if you couldn't keep those in like in your head, then how am I supposed to trust you with mine?
Well,
So I think that's very interesting. Um and you said that you've been doing this a long time, and you're in like the ministry. How has psychotherapy and ministry kind of come together for you?
uh, well, I think it's the ground of my very being. It's how I understand myself. Um, I mean, I was raised in a Christian context, so the way I conceptualize my life is out of that context, not in a doctrinal way or not in a rigid way.
Hmm.
Um, and so that forms the kind of the ground, the foundation of who I am and why I do what I do. Yeah, it also is why I volunteer and spend my free time in Haiti, because I want I've been given a lot, so I want to offer a lot back. Um, was I answering where you were headed on that?
Yes. So I guess with that is like bringing this religious spiritual side of Christianity to therapy, is that with that, how have you navigated uh trying to work with someone who might be non-religious, or like a strong like atheist, like a
Mhm.
very against religion?
So uh, I don't have an agenda on how a patient needs to think, feel, or conceptualize their life. As I was saying earlier, one of the reasons I do this is I learned something more about myself. So I really trust that an atheist or an agnostic is going to offer me something. Or, I mean, I work with people with Eastern religions, with Buddhism, and they bring a lot to the table. So again, it's my curiosity and my willingness to learn. Um, yeah, I don't have an agenda on how people ought to see their own life.
Mhm. Okay.
It's
And
more of a
that's
statement about how I see my life.
okay. And that's good because from speaking with some of my friends with some of the therapists that they've gone to, it seemed like that therapists either had an agenda or had a specific way that they were trying to push someone to think about something like through their own lens. And I think that as a therapist, like you said, it's just being open and being a receptacle of knowledge for what the person is bringing to the table.
Yes. Now, I really like what you brought there. My very first clinical rotation was in Yardville State Penitentiary in New Jersey. And I was given the sex offense tier. And I was working with a guy who is in jail for a long time for rape. And at one point I just said, "Why'd you do it?" Well, okay, so I do have some boundaries. I
Yes.
have some limits. I have some feelings about. And he said, "Well, if she wasn't walking down the street there, I wouldn't have done it." Well, of course I got strong feelings about this.
Yes.
That's why you're in jail. Um, but for the average person in a private practice, no, I don't have to. I don't have those kind of issues or boundaries. Um, but there are some places where when I find people who are living a deceitful life or um, kind of a manipulative life, um, I want to explore with them what they're up to, try to understand. Uh, so it doesn't mean I approve of everything that goes on in my office.
And I think and I mean, that's good to hear because I think a lot of times people just look at therapists as it's like, oh, it's just some like amorphous, just non-judgmental being. It's like it kind of removes a little bit of the humanity from a therapist, but I I feel like it's good to know that there are like certain limits, but it is also a place where you're going to not be judged because I've heard some of my friends say that they go to therapy instead of talking to their friends because they don't want to be judged.
Yeah. Now, judgment has gotten a bad rap. Judgment is also discernment.
Mm,
And there are reasons I discern things. It may be good for me, it may not be good for me. But I want to be clear, I'm not putting that on you. I'm not
mm.
putting that on a patient. And exactly, your friends go to therapy so that they can be heard and understood. They don't want to be preached at, they don't want to be lectured. I mean, if we need that, we go to our parents, right? I mean,
Yeah. Yeah, that's
so
true.
they're not looking for that. I mean, I know my parents wanted the best for me and I wanted the best for my kids and stuff, but that's why we go to the therapy, is to be understood.
And I feel like the closer you are to someone, the harder it is to be objective for them.
Oh,
And
preach it. Oh, preach it.
it,
Exactly.
and it's really hard because sometimes it's because I've asked some of my friends before, it's just like, why didn't you just come and talk to me about it? And it was actually one experience I had with a friend is that um I did ask him, I was like, you could have just came and talked to me about it. And he said, it's like, you were part of the problem. That's why I couldn't talk to you about it.
Hmm.
And it
Hmm.
kind of took me back because I like to think I can be a very objective person
Hmm.
and give good advice. Like I said earlier, it's like I kind of give advice to a lot of my friends, I like to think of myself kind of as the friend therapist.
Mhm.
Um, but it is hard to be objective, especially when it's that close, like close to you.
Exactly. You love him. I mean, you don't want that something to happen to him. I do want to affirm that I am not objective with my patients.
Mhm.
That
Okay.
may be one of the misconceptions that we go way back when you asked me earlier in the interview. I'm a champion for them. I want them to succeed. I want them to live full lives.
Mm. Yeah.
If they choose not to, I'm going to keep working with them. They don't have to change. That's not a requirement. But I am a champion of them.
Okay. And you want okay, and you want the yeah you want the best for them, and I feel like that's also what your friends want as well. It's just I guess it's the tools for you to be a champion your friends do not have.
Well, and
Most likely.
I have a different level of investment with my friends.
Mhm.
I want them to think well of me. I you know,
Yeah, because it's hard to, especially with the real blunt truth that you have to give somebody sometimes during, I assume sometimes during therapy, is that it's like if a friend were to say that to you, you probably not talk to him for a little bit because it would be hurtful, but it would also be growth for you.
I really like what you said there because sometimes psychotherapy is hurtful. I want to avoid harm, but sometimes hurt can be redemptive in healing. And then sometimes it's just nasty. And I want to avoid that.
And I guess with that being said, is that how I guess in your in your practice in the years that you've done it, what has been like I guess the hardest truth you've had to um, either explain to someone or truth that you've gotten to with someone within your practice? I know you probably can't be specific because of
Well, I mean, I remember saying, you're effing up your life and you're effing up your family if you keep doing this.
Okay.
I,
And
yeah, um, there have been, I mean, I can tell you two funny stories if you want to hear.
of course.
I was working with a mother and her son, and at one point, her son became irate with his mother. And I said, you need to knock that SHIT off. And, and he jumped on his mother physically. And I had to pull him off and call for help to take him out of the building. Um,
Oh wow.
oh, wow was right. And then another time I was working with a couple, and often when I work with a couple, I have a co-therapist
Mhm.
so that we monitor and work in a deeper way together. And this guy, he was an attorney and he was chewing his wife's butt. Nasty, nasty, nasty. And I told him to get his effing ass out of the office. And he stood up, and I thought he was coming at my co-therapist, the woman. And
Mhm.
so I stood up. I said, if you need to, we're going to do this. But you need to get your ass out of here. And he said, oh, yeah, you're being real brave. And then he stormed out. So, I mean, I've had a couple of like intense moments over the years.
At this, well, now I need to ask. Wait, are you allowed to tase people in therapy? I would invest in a taser at that point.
You know, one of the things about therapy is I did not know that he had been um, using Adderall and he'd been up for 2 or 3 days.
Mm.
Um, so sometimes we just don't know things. When people come in, we don't know what we're really encountering. So fortunately, those are very unusual circumstances.
Yes. I doubt most of the time that people get physical in therapy sessions. Something I wanted to ask you is when you brought it up is with the mother and the son and then the couple, is that is it harder to have a therapy session where you're working with two people that have a relationship together and you're pretty much trying to tease out the problem there, because it's hard to, I feel like it's easy, well, can't say it's easy, I'm not a therapist, but I feel like it's easier to work with one person because you're having their story and then you're working through their emotions. But when you have two people or multiple people there, it's a little bit harder.
Oh, it's much more complex because each of the person in both circumstances, each of the person has all kind of feelings about me. They have all kind of feelings about their partner or their mother or their son. And they have all kind of expectations that are floating around in there that we need to tease out, which is the word you used. Yeah, it's enormously more complex. And sometimes I like one person better than another. And I've got to pay attention to that. So, yeah.
Have you had situations where you've looked at it and be like, no, this person's right? It's like you are in the wrong there.
I've not done quite that, but it's like, oh my God, you're such a pain in the what.
Mhm.
And 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 then I also think about, why does the other person continue to tolerate that? I mean,
Mhm.
I'm thinking about a woman I work with who tends to pick bad men. And she stays in these relationships with these bad men. And I'm like, you're a wonderful human being. Why do you keep doing that? And but it happens.
And it's hard to, especially like a situation like that, it's hard to tell someone, it's hard to get someone in a different type of mindset, because for them that might be something that is normal for them and comfortable for them. And if you tell them to do something different, I've found like us as human beings, we tend to shy away from uncomfortability a lot of the time, even if that could lead to growth. Sometimes people don't like to be uncomfortable.
Well, growth only comes from discomfort. You're right. Um, but I would change a little bit what you said. A lot of people stick with the familiar,
Mm.
regardless of its success. But the familiarity is something that people really latch onto.
Yes, and that's, it's hard to get people out of that familiarity zone. Um, so there were two things that two let me, I don't know how the proper way to say it, but two mental health diagnoses that I wanted to talk about with you.
Bring it. Yeah.
The first one is depression.
Yes.
Could you explain what depression is and then the difference between just sadness, just feeling sad, and being depressed?
Sure. Sadness is a loss. It's a hurt. It's something has happened and I'm feeling pain. Depression, the easiest way to explain it is it's when anger gets turned inward. It's anger is an implosion that causes a person's whole affect, mood, function to shut down because it's coming from a place of anger. Now, I'm talking about situational depression. We have all different kinds of depression. So you were talking about that in a general sense, but there is endogenous depression, which, in the brain chemistry, some of our synapses are not firing the right way. And sometimes a person can have what we call unipolar depression, which is just kind of a blue all the time and sour mood. And then we also have the bipolar depression, where someone is kind of like going up and down, riding a roller coaster. And sometimes after an up high experience, then they circle back down. Those are much more biological than. So I took a guess that you were thinking more about the situational depression.
Yes, more so it's like when, say if something something happens like in terms of, I don't know, like a breakup or something like that, and a person, in my friend group, we call it the spiral. It's like where someone just starts spiraling down.
Exactly. Sure. Yes. Right. And then you can point to a circumstance of what happened in that moment. Somebody got dumped. They loved somebody, and boom. All right. They're lonely. They're hurt, and they're also mad because they may also be thinking about, God, if I only done X, Y, Z, or if I shouldn't have said blah blah blah. Mhm.
And that's interesting because I've never heard of depression described with anger. It's like it's always, the way that I've heard it described is always just like sadness on steroids. And that the way that you explain it is like that's from speaking with some friends who have dealt with depression. It's like that's more so of what it is. It's the anger at yourself. And for some of my friends, it was the anger for letting that person hurt you.
Yes. Yes. And if we can go further, then usually there is blame on top of that. And then there's usually shame on top of that. And that really adds to the spiral that you were talking about with your friends.
Yes, yeah. Because a lot of, and with that, with the shame part of it, is that a lot of people will sometimes pull back from everyone else because they don't want to let them know that they're feeling this way, that this situation affected them in that way.
Yeah. I like something, I like something that you're saying there. And I think it goes way back to um, something about psychotherapy that you asked very early on. There seems to be a hesitancy to rely on community. We're so much more going to pull ourselves up by our bootstraps. But one of the beauties in the African American community or indigenous communities has been the sense of community. We all hold each other. We're in
Mhm.
this together. And I think we've lost a lot of that. So, yeah.
And I think that and it's very interesting. It's like with before it was like a formal science and like like psychology therapy, like going and talking to someone through your problems. It's like in different, very different communities, it's like there were people that were tasked with that, that might have been called something else. Like you might go to a shaman and they're not doing a ceremony, they might just be sitting down and talking with you. And I find it interesting because I'm not necessarily like a very big religious person, but I understand how religion has helped people. Because if you don't go to therapy and say you pray all the time and you talk to God, that is therapeutic within itself, because you have in your mind, you have someone there that is listening to you.
Mhm. You're right. Yeah. I mean, for years, we've had shamans. We've had the in native cultures, we've had the healers. I mean, we have the rabbis from Judaism, and yeah, I mean, we across all cultures, we've had these healers that have. I think we have made it more scientific now, and I think we're more successful. Um,
Just yeah,
but I
just a little bit.
but I still went and did a sweat lodge, and I mean, I still put myself in those kind of places to have those experiences.
and I've and I feel like, especially like moving forward with it, is because before, with like the shamans and everything like that, like some in some cultures, there would be a ceremony, there'd be an ingestion of some type of drug that would help you open up more.
Mhm.
And I feel like it's kind of coming back full circle, but in a scientific way, because I've seen that, especially with PTSD, with depression, doing psilocybin therapy, that they found out that like that actually is proving to be beneficial with people. So I'm
Mhm.
interested to see where therapy will go with the um, combination of the therapy, but also with like psychoactives as well.
Sure. And don't forget ketamine.
Oh, I didn't know that there were studies going on with the use of ketamine as well.
It's gone beyond studies. It's common practice now. Ketamine for depression. Yep.
Okay,
Mhm.
did not know that.
Yep.
Uh, so with that, with depression, you said that there's sometimes that the synapses are just not firing correctly.
Mhm.
Um, so within that is that I guess there are some depressive diagnoses that require um, medical, a prescription.
Yeah, medical intervention. Sure. Mhm.
Yes.
Yeah.
Do you think that there might be an overprescription of these types of medications?
Man, you are so spot on. Our culture now is instantaneous. We want to feel better, make it go away. And I think that's one of the inhibiting factors on why some people don't enter psychotherapy, because they can take a medication and don't feel it.
Hmm.
Hmm. Yeah. Is it overprescribed? Yes, of course. And who's doing the overprescribing? Usually it's the family practice doctor or the internist. Um, Most psychiatrists, or at least around where I live, they're only seeing people that are more complicated, that need more complex ways of working with medication. But statistically, even if a person's on medication, the effectiveness of their healing, whether it's depression, anxiety, PTSD, but even some of the more thought disorders like schizoaffective and schizophrenia, psychotherapy is essential.
Mm, okay. And if we have enough time, I want to circle back to schizophrenia because that's also, I feel like that's also another um, mental health disorder that gets improperly depicted in in the media. Because a lot of times I think people assume that if you're schizophrenic, then you have a propensity for violence, where in return you're actually more likely to be on the receiving side of it.
Yes, what I've noticed, and we don't get a lot of people with schizophrenic or the schizophrenic diagnoses in private practice, but most of those people are really frightened
Mm,
and they're really scared. And of course, clinically, when a person is really scared all the time, we call it paranoia. Um, and that's all paranoia is being frightened. And when they get threatened easily is when they kind of get reactive
mm,
in some unusual way, which could be aggressive, but very seldom, very seldom.
okay. And with the paranoia, you said that that's essentially just them being afraid. Um, I kind of want to segue into the second diagnosis that I wanted to talk to you about is anxiety
Mhm,
and what that is and how's that different from just being nervous or
mhm.
being like I feel like sometimes like with anxiety, the way that some of my friends have explained it to me, it's like it's a fear of what can happen.
Well, I like what your friends are saying. So most often now, anxiety and nervousness are used almost interchangeably.
Oh.
But I think of nervousness as there's a situation like I'm going to go on my very first date, or um, you know, my daughter's having a baby, so I'm nervous. Yet there's a situation, a circumstance that is triggering my feelings. Anxiety is much more, I think, generalized. It's more free floating. And as your friend says, it's about something in the future that could be happening, but we don't even know. So we're not staying in the present and the here and now. We're kind of leaving the here and now and going off to something in the future, which Yeah, is what I would call the generalized anxiety. We can also think about that in terms of obsessive compulsive, that we're kind of afraid that things are going to get out of control. So we develop internal rituals of how we're going to cope with things being out of control. So there are a variety of ways we can see anxiety coming forth.
Mm.
PTSD is also another anxiety diagnosis.
Oh, that falls underneath the umbrella. Okay. Well, that makes sense.
Okay.
That makes a lot of sense. And I came across something, and it was a psychologist, and they said the way that they described anxiety and depression, it was depression is when a person is stuck living in the past, and anxiety is when someone is stuck living in the future.
Oh, I like what they said.
And I
Yeah,
feel like that's very,
yeah, that's helpful.
yes.
Yeah, I like it.
So I guess with that is that when you describe the difference between depression, sadness, and anxiety and nervousness, I guess like maybe a rule of thumb is like if it hinders your day-to-day rituals, then it's not just like a common everyday felt emotion. It can that kind of transcends into a disorder. Is that like a right way of describing it?
Well, I don't have the book in front of me to read it to you,
Mhm.
but yeah, if it becomes a problem in your daily functioning, then I think it's problematic. So if I can't sleep at night because I'm worrying about what? Money, relationships, whatever. Yeah, sure. And that means I'm waking up and I'm not refreshed and ready to start my day. So yeah.
Okay. And so for an individual that might be dealing with depression or dealing with anxiety, um, from a therapeutic standpoint, like what are some things at home that they can do to help kind of alleviate the stress of it in between like seeing a therapist?
So I didn't really quite follow that. We're talking about anxiety.
Well, depression and anxiety. It's like either one. We can start with either one, but like what are some things that someone could do to help, like what are some coping mechanisms that can help with that?
Well, I really find with either anxiety or depression, um, I wish my patients were more graceful with themselves.
Mm.
Uh, they don't come to these circumstances out of the blue. So there's probably some kind of pattern that's been established, which has caused them to feel the way they're feeling. So when I think about being graceful with oneself, it's accepting that these are the cards that I've been dealt with. These are the cards I know how to play, and these are the ways I know how to play them. And I need to really sit down with someone to kind of understand a different way on how to approach something. But I can't do that without first accepting or first being graceful or being compassionate, whatever kind of term works best, with oneself. So what I often find are the people who come in, if they're depressed, they're already kicking themselves in the backside.
Hmm.
They're angry that they can't get out of their circumstance. They think they ought to be better off or doing better XYZ, better in school, better in job, better whatever. And so that would be something that I would want them to kind of be mindful of during the times between our meetings, and understand that they're doing the best they can.
Mm.
And I really want to emphasize that most of us are doing the best we can.
Yes. And
We really are.
we we're all eating a shit sandwich, and it's just some of us have different condiments on it. And that's that's the best way I try to explain it to people. It's like,
Well,
oh,
okay then.
we're all eating it. It's just like we just and that's unfortunately that's the thing that we call life. And I feel like a lot of times it's about how we decide we want to go through it is it's ultimately up to us, but it's not in a way to which it blames someone
Right,
for
including
what they're feeling.
ourselves. Mhm.
Yes.
When it comes to the anxiety piece, you called it a shit sandwich. I think about when we have a pie, we cannot eat the whole pie at one time. So just take a sliver, just take a slice, and that's what we deal with in terms of anxiety. You stay focused in the here and now. This is what we can do. But if we're worried about eating the whole pie at one time, we're only going to get sick. So it's only going to be overwhelming. So just stay focused in the here and now.
Mm. And that's, I guess, in therapy, that would the term is state grounding and grounding techniques, correct?
Sure. Mhm.
I told you I could have been one. I could have been one. Uh, I guess so. My for people that might find themselves in a position where like they are like they're like the therapist of the group, like people come to them for advice and everything like that. It's like what would your advice to that person be? Because they're the ones that everyone always goes to.
Knock it off. It can be a burden.
Okay.
Just be part of the crowd. Enjoy yourself.
Okay. Okay. Well, yeah. And
Yeah.
that's hard to do because if especially when you're an empathic person, it's like you don't want people to feel that sort of way, but then it's also realizing you can't control others' feelings.
No, the only person you can control is yourself. And sometimes we're not even very good at that.
Yeah. Well, I've seen a lot of people struggle with that.
Yeah.
um I think okay. Um so the other thing that I wanted to kind of talk to you about was so since like with the overprescription of um like the overprescription of like medications for anxiety, depression, things like that, and like with marijuana becoming like more legal, is that do you think that like going into the future, like looking at that, like do you think that that could be a healthy alternative to other more like traditional medications that have been prescribed?
Well, it certainly seems to be very helpful with anxiety
Mhm.
and sleep. Um, the concern I have is that for some people, it lets them zone out and disassociate from their life experiences. So depending on how that's used, it can be, I think it possibly effective. Yeah, but it also, like anything else, is can be misused.
Okay. And I guess the question is, well, one of the questions I have is that with being in the ministry and more times than not, it's like with religion, people tend to be a little bit more conservative about certain things. It's like has that conservatism, has that like have you dealt with that in your therapy sessions with people that, like you said, it's like you get more pushback from people that are more that come from your culture or your community than other ones? It's like, so how is that conservatism like kind of played into psychotherapy?
Well, I'll back up. I You probably can pick up I'm not conservative.
Excuse me.
You probably can pick up I'm not conservative.
Yes.
Um, but because I've been to seminary and have been ordained and uh, there are people come with an expectation of who I am and how I think or how I see things.
Mm.
And that's been difficult for those who are very conservative religiously,
Okay.
because they have an expectation of who I am or how I am. That's where the struggle. I've not really had an issue with. I mean, I have a real concern with a patient of mine who wakes up and starts with a bowl of weed and is stoned throughout the day. Yeah, I got a problem with that. That's not very healthy. He's tearing up his lungs and his not advancing in his career, and he's really smart, and his marriage is like on the rocks. So, and his kids see him stoned all day long. So yeah, I mean, that's a misuse as opposed to somebody who, and I live in Georgia. I don't know where you are, but I live in Georgia, and you cannot get medically prescribed cannabis here.
Mm-hmm.
You can get CBG or CBD oil, which is helpful.
But yes, the actual marijuana. And that's a very interesting example, because it's not this like smoking of marijuana within itself. It's more so it's the implications of it that, like you said, the misuse that is the problem of it. And I think a lot of times people will look at it as well, say like, oh, well, you just don't want people to smoke. Because it's like, no, that's not the case. It's like this person is messing up their life with the use of that.
Right, right. So when you go to a sweat lodge, you take peyote, right?
Mm-hmm.
So that you deepen your experience.
And I think it's just having the proper use of it.
Sure.
And yeah, and I find it very just, and this is just a tangent, I find it very interesting that stuff like mushrooms, LSD, um peyote, like DMT, those are things that are illegal, but yet I can go buy like a fifth of Jack Daniels, and that, like, I can't see a therapeutic implication of that. It's like that's legal, but the other ones aren't.
Well, talk to your congressman.
Yeah, sorry. That was
But
just my own little tangent.
actually, peyote is legal on some reservations.
Oh yeah, yes. Okay, yeah, that is true. Yeah, but mushrooms were still. I think Oregon, it's legal now to be prescribed in therapy sessions, but I'll have to look into that. Anyways, that's neither here nor
That's
there.
not my forte, right?
Yes, neither here nor there. But I'm not gonna hold you up too long. But I did want to leave off with this question: is that what advice would you give to like new therapists that might be struggling in trying to, I guess, either connect or trying to help help their patients?
I really liked that question. I presented last year at a conference and found out that I was the longest serving supervisor in the state of Georgia
Okay.
last year. I've now gone inactive that way. So I've had the opportunity to mentor a number of younger therapists. The first thing I would say to them is get your ass in your own therapy. Do your
Okay.
own work. Second, get with a supervisor who really understands and can mentor you. I think those are the crucial things, because it's what comes from within that makes me available to my patients. It's not about the techniques. It's about the person of the therapist.
Mm, okay.
And our grad schools are really screwing up. I would use a harsher word, because they're all about techniques, and they're screwing up our young clinicians. Because it's fashionable, it's quick, down and dirty, and it doesn't really help.
Okay.
End of
Okay.
sermon.
And I'm sorry, I did lie. I lied to you. I have one more question, and this is a question I really did want to get to, and I just looked at it and remembered. Um, so, how do you know when you're done with therapy?
I trust the patient will let me know. If they come in for a particular problem that they want to address, then when that gets addressed. But more often than not, the people I work with, they want someone to walk along the journey with them, to be honest and reflective about their life choices and their life decisions. And when they run out of things that they want to talk about, I know that they're done. And I'll wish them well. And the door's open if they would like to come back.
Okay. Okay. And that's great because I've I've always wondered, because I'm an open book. I've never gone to therapy, but um, I've always wondered with some of my friends that do go to therapy. I've asked them, it's just like, how, like, what is the, I guess, the exit strategy? Because if, like you said, is that they came to you with a certain thing that they wanted to talk about, and then I guess from there they might have uncovered other things. It's like, but I've always wondered, is this like, is, I guess, what is the end goal of a therapist?
Well, to say goodbye.
Okay.
um, but I also want to add this codicil, Ashanti, and that is so often a lot of my patients move from individual to group therapy,
Mm,
so that they're less working with me and they're more working in a community, so that they're more resilient on their own with their peers.
okay.
So group is a great way to begin that transition.
Group therapy. Okay. Okay. And then I guess with that is like, so in like, what would that look like? Would the person bring in like 3 or 4 of their friends and like have like,
No, I select the group,
okay. Okay.
and they only use first names, and they don't see each other outside of group, and so that they can be incredibly honest with each other.
Okay. 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 And that's okay. Because I've always thought of group therapy as just like literally a group of people that know each other going to a, a therapist, but I guess that's just the like ignorance on my part. Uh, okay. Um, but thank you, because I definitely wanted to get to that question because uh, I always I always look at I look at a profession like within itself and always look at it as like, what is the end goal? Like what should be the driving force from it? And like with doctors is that I feel like with most doctors, it should be is just, if I do my job correctly, I will never have to see you again. It's like, usually like, I want to be phased out of the need for this profession because I'm addressing something that's wrong. So I find it just like very interesting, and that's good that for you is that your thing is like your end goal is to say goodbye.
Yes, physicians have trouble diagnosing, but once they figure it out, they know what to do.
Mhm.
For us, it's easy to know what's going on. It's difficult to treat.
Mm, okay, I'm gonna have to sit and ponder with that one.
You go.
Okay, well, I want to say thank you again
You're welcome.
for coming on. It was a great conversation, and uh, I look forward to maybe having you back on, and we can go through a couple more diagnoses. If we can go through the whole DSM-5.
There we go. I enjoyed my time with you, Ashanti Ali.
Thank you, thank you,
Yes.
and everyone, that has been another episode of Tomb Talks with the Pharaoh, and I'll see y'all next week.